Hello, Dr. Dandip. Can you hear me?
Yes, I can hear you.
Okay, thank you. I want to make you co-host. Is it okay?
Hello, Yukiko. This is Dr. Nirmal Singh. Good morning.
Good morning. Good morning. Who is it talking to me?
This is Professor Nirmal Singh, chair of the meeting.
Okay, thank you, thank you. Yeah. So the session will start in 6 minutes.
Sure, sure.
Hello, Dr. Nirmal. Hello, Dr. Dandi.
Hello, hello. Good morning.
Good morning. Good morning.
Good morning.
Morning, Dimple Singh, sir.
Good morning. I'm Reecha.
Good morning.
morning.
Good morning. Good morning, ma'am.
Good morning. Good morning.
एक मैम डिम्पल मैम मैंने
हाँ
एक
जी।
आपको ना अभी पीबीआई के ऊपर वो भी भेजा है रीसेंट एपन 58 का बैकड्रॉप
Okay.
इफ यू वांट टू चेंज मैम
Yeah, sure. Sir. Sir, I have downloaded the logo, but how to insert it? Can you help me?
Ma'am, there is a video icon on the left hand side of the Zoom. There is an icon there. You just click it, and from there you set my adjust background and effect. From there you can adjust.
There is a video icon.
On that series small point over there, you just click it. Few things comes: integrated camera, blur my background, like that.
मैम जहां से आप वीडियो ऑन करते हैं ना अपना,
हाँ,
हाँ
video
हाँ,
settings.
you just open it and choose virtual background.
Okay.
Choose virtual background, तो वो ओपन हो जाएगा विंडो, एंड देन टेक दैट JPG file.
Good morning, Tandeep sir.
Good morning, ma'am. Good morning.
Good morning, sir. मैम उसमें ब्राउज करो आप, ब्राउज ऐड हो जाएगा, लेफ्ट पे थोड़ा सा आइकन होगा ऐड करके।
Okay, ठीक है।
मैम फिर डाउनलोड करा होगा ना, उसमें आप ऐड कर लेना।
Browse is there in
ऐड हो या होगा या ब्राउज, तो फिर उसमें जहां पे आपका डाउनलोडेड होगा ना, तो वो ऐड हो जाएगा मैम नीचे।
Okay.
मैम फॉर द टाइमिंग एक बार ब्लर कर लो बैकग्राउंड.
Okay.
Dr. Suresh and Dr. Nimark, it's time, so maybe you can start.
Okay, Nirmal sir, can we start now? Sir, mic on.
Okay. Should I proceed now? Am I audible?
Yes sir, you are audible. You are audible, please.
Dr. Suresh and Dr. Nimark, it's time, so maybe you can start.
Okay. Thank you so much. So,
Sir, can we start now?
yes, we can start. So, good morning, everyone. So welcome to this 58th meeting of APAN, which
Sir,
is.
mic on.
I'm not audible. Hello.
You are audible sir, you are audible.
Okay. Should I proceed now?
Yes sir.
Okay. Am I audible?
Yes sir, you are audible. You are audible, please.
Dr.
Okay. So good morning, everyone. Welcome to 58th meeting of APAN, which is being organized in our neighboring country, Islamabad, Pakistan. This particular session is dedicated to natural products. Specifically, we are dedicated this session to nutraceuticals. We'll be having some important talks on nutraceuticals. Nutraceuticals, basically, they are the products, compounds which provides benefits of nutrition as well as pharmaceuticals, and they promote health along with they also prevent us from various disorders and help us to manage various disorders. So there is a lot of trend these days. We see a wide range of nutraceuticals surrounding us, including vitamins, minerals, dietary supplements, functional foods, and a number of bioactive compounds. We see, if you look at the global market, the current share of nutraceuticals in the market is over 450 billion US dollars. This is a huge amount, and this is projected to be over 950 billion US dollars by the year 2032. So we see a very fast growth as far as global share is concerned, market is concerned. Nutraceuticals, they are getting property and because nutritional benefits. They provide nutrition benefits as well as they help us improving our both physical and mental health. I think there are a lot of issues which need to be discussed as far as nutraceuticals are concerned. There are the current trends. Then there are issues related to their bioavailability and there are issues related to their regulations. So we'll be discussing all these three aspects in our coming three lectures by prominent speakers. So we have three lectures by prominent speakers today. The first lecture will be on current trends in nutraceuticals, which will be delivered by Dr. Reecha Madaan very shortly, right from now. The second talk will be on herbal cosmeceuticals, which will be delivered by Dr. Dimple Sethi. The third talk and the last talk of the session would be on the regulatory perspective of nutraceuticals, which will be delivered by Dr. Suresh. So let me introduce our first speaker of the day, Professor Reecha Madaan. She'll be delivering a talk on current trends in nutraceuticals. Dr. Reecha Madaan is a highly learned speaker. She is a professor and principal at Adesh College of Pharmacy, Adesh Medical College and Hospital, Ambala, Kent, Haryana, India. She has done her graduation and post-graduation from MDU University, Rohtak, and she is a doctorate in pharmacognosy from very reputed institute, that is Punjab University, Chandigarh. She has a lot of experience, over 22 years of teaching and research experience she is having. Her research area includes exploring traditional plants for various pharmacological activities and role of natural polymers, gums, and mucilus as a pharmaceutical excipient in drug delivery. One of her research work on isolation of natural molecules from plant sources is appreciated by SAMI Laboratories, Bengaluru. She has guided more than seven postgraduate students and 3 PhD students, and she has published more than 60 research papers and filed 8 patents, out of which 1 patent is already granted. And she has authored several books as well. Her textbook on herbal drug technology is being well received, and she is also have edited a book on herbal bioactive based drug delivery system. She has one startup company as well, that is Herbo Wien Private Limited, with the support of Chitkara University. She has delivered many invited talks in different national and international conferences and seminars, and chaired various technical sessions in different national and international conferences. She is a life member of various national and international bodies like IPGA, APTI, SOP, and Society of Pharmacognosy. So, Dr. Reecha, will be getting benefit from your vast experience. So she will be delivering a talk on current trends in nutraceuticals. Now I would like to invite Professor Reecha Madaan to deliver her talk. Dr. Reecha Madaan, it is over to you now. Thank you.
Thank you, sir. Thank you so much, sir, for the warm introduction of mine. First of all, I want to congratulate the team APAN58 for organizing such a wonderful and thematic online meet. Also, I want to thank organizers for giving me opportunity to interact with all of you. And today in my talk, I will be giving a brief insight on current trends of nutraceuticals. Let me share my presentation first. Yes, is it visible?
Yes, it's visible, but not slideshow.
Okay, just is it visible now?
Yes, it's
Yes,
slideshow now. Thank you.
Okay.
visible.
So I'll be giving a brief insight on the current trends in the nutraceutical products available in the market. We all are consuming foods because they are rich in nutrients like carbohydrates, protein, lipid, vitamins, and minerals. But apart from that, some dietary components they also contain polyphenols, terpenoids, flavonoids, isoflavonoids, carotenoids, limonoids, phytoestrogen, omega-3 fatty acids, and probiotics, which play an important role in human health. They provide medical health benefits, including the prevention and the treatment of diseases. So, uh, so consumption of not only nutrients in the diet, but also other components which offer health benefit are termed as nutraceuticals. The concept of nutraceutical is not new. It is around. It is very used ancient by the Hippocrates that let food be the medicine and medicine be the food. The nutraceutical term is derived from the two words that is nutrition and pharmaceutical. Nutrition means requirement. Nutrition they are required for health, and pharmaceutical that is remedy for sickness or injury. So nutraceutical is a preventive medical approach. They are the nutrient-rich dietary substances derived from whole food, part of food sources, which offer health benefits beyond the basic nutrition. The term nutraceutical was coined by Stephen Deffelis in the year 1989. But if you just look at the market, the three terms are always used: the nutraceutical, functional foods, and dietary supplements. They are confusing and they can be used interchangeably. But the best, they can be better understood by the example of your curd, yogurt, and yak, right? Curd, we all are consuming curd, that is dahi. It is a fermented dairy product which is filled with vitamins, proteins, lactobacillus, and other probiotics. But curd is coming under your nutraceutical. If you just look at the example of yogurt, in curd, the bacterial population is mixed bag, but in yogurt, the specific strains of lactobacillus bacteria are there. So yogurt is a functional food. But if you just look at that, the Yakult, which is a probiotic drink which is originated in the Japan in 1935 and is now sold in over 40 countries. It is a fermented milk beverage that contains billions of live and active lactobacillus specific strain of bacteria, that is Shirota bacteria, which are considered friendly bacteria that can help to for the digestive imbalance. So Yakult is a fat-free and a gluten-free. So if you just look at these examples, so curd is coming under your nutraceutical. These are the dietary supplements made only from the food which is used for the prevention of diseases. Functional food means you have modified the nutritional value of the food. Like curd is the simple curd which contains bacteria of mixed strains. But in case of yogurt, the specific strains are used. And Yakult is a sort of your dietary supplement. Now, next, my question is why the nutraceutical demands are increasing day by day? Because it is impossible to get adequate nutrition from the routine food. We are living in highly toxic environment full of pollutants and pesticides, which lead to increased incidence of diabetes, obesity, cancer, vascular diseases, and other neurodegenerative disorders, aging as well. So raised demand for healthcare shows enormous increase in the cost of medical care. Medical care. So nutraceutical is the best strategy to strengthen the immunity rather than depending on the antibiotics which are harmful. If you just compare the nutraceutical with pharmaceutical, nutraceutical basically works on the root cause and takes longer time for the recovery, where pharmaceutical shows instant effect. Nutraceuticals have rarely side effects. Nutraceutical basically focus on the prevention and wellness, whereas pharmaceutical focus on the treatment. The nutraceutical products
May
do
I
not
interrupt,
require.
Dr. Reecha, may I interrupt in between? Because
Yes,
I can see only the presentation, not the slideshow.
let me see. Let me
Uh-huh.
check first.
Please correct it.
Is it okay now?
Yes, yes, yes. Now it's okay.
Okay. And nutraceutical products do not require FDA, stringent FDA approval, whereas pharmaceuticals require FDA approval. Nutraceuticals products we can use without prescription, whereas pharmaceuticals require prescription except the OTC product. The global nutraceutical market is expected a huge growth if you just look at from 1999 to the year 2002, and in the coming year also we are expecting a huge exponential growth. The rising health concerns are likely to drive the product demand over the next 8 years. And if you just look at the overseas market, the USA and Japan is pioneer in the nutraceutical industry, followed by Europe, in which Germany, Italy, and France are the major competitors. Among the Indian markets, the multinational companies like GSK, Amway, Kellogg's, and National and Nestle play a vital role. These are the common nutraceutical products which are available in the market, like calcirol D3, capsmerate, glutathione pills for the skin whitening, GRD, that is a nutritional supplement by the Zydus Cadila, in life heart care supplement comprising of various herbal extracts like Arjuna extract, Ashwagandha, green tea extract, etc. Nutruva, Pediasure by the Abbott Laboratories, and the Proteinex by the Pfizer. So if you just the various products are available in the market, and we can classify these products on the by two ways. First, based on the chemical content, they may comprise of the mixture of nutrients like vitamins, minerals, or herbal ingredients. They can be coming under your dietary supplements, and if the food available in the market, they are further classified as traditional nutraceuticals and non-traditional nutraceuticals. Non-traditional nutraceuticals are further classified as fortified and recombinant. New carbohydrates, proteins, and vitamins. Vitamins and minerals provide the preventive approach also, and they also enhances the immunity. They are acting as antioxidants like vitamin A, vitamin E, vitamin C. They are used as an antioxidant. Vitamin K is essential for blood clotting. Minerals also play a significant role in the prevention of disorders like the role of folic acid, the role of calcium in the maintenance of bones and teeth, iron in hemoglobin, magnesium helps in the nerve and muscle functions. Iodine is essential for the proper functioning of thyroid. The herbal extracts also play a vital role. I did told you earlier that Arjuna bark as a cardiotonic, aloe vera, chamomile as chamomile tea, the use of garlic as antibacterial, antifungal, antithrombotic, ginger also, ginseng is a well-known adaptogen, ginkgo biloba, it is a vasodilator which enhances the peripheral blood flow and is widely used in Alzheimer's disorders also. Licorice as an expectorant, plantago, turmeric, wheatgrass, which is a general tonic. Dietary supplements are also available. Dietary supplements are those which are available in various dosage forms, including tablets, capsules, powders, extracts, and concentrates. Like your protein supplements, like ketogenic diet. Ketogenic diet or keto diet is a dietary approach characterized by a high fat and low carbohydrate intake, aiming to facilitate weight loss, enhances mental clarity, and the boost energy level. By significantly reducing carbohydrate consumption and increasing fat and protein intake, this diet induces a metabolic state called ketosis, where the body utilizes fat as its primary source instead of carbohydrates. Carbohydrates typically serve as the main source of energy production in the body tissue. However, when carbohydrate intake is restricted to less than 50 grams daily, insulin secretions decreases significantly, leading in the body a catabolic state. As a result, glycogen stores are depleted, triggering a series of metabolic changes. During ketogenesis, insulin secretion is low due to feedback from blood glucose level, leading to a decrease in the stimulation of fat and glucose storage. Other hormonal changes may contribute to the increased fat breakdown, resulting in the fatty acids. These fatty acids are metabolized to acetoacetate, later converted to beta hydroxybutyrate and acetone. These primary ketone bodies like acetoacetate, acetone, and beta hydroxybutyrate accumulate in the body as the ketogenic diet is sustained and serve as an alternative source for the body. And nowadays, ketogenic diet is widely used for the weight loss also. Phytoestrogens, these are found in soya foods. They enhances the estrogen level and prevent against breast cancer and hot flushes. Glucosamine sulfate and chondroitin sulfates, these are effective and safer to alleviate the symptom of osteoarthritis. And processed dairy foods, commonly in the market, whey proteins are available. Whey protein is a specific type of protein from whey, the watery portion of the milk that separates from the curd while making the cheese. It is commonly used as a protein supplement. Whey protein is a supplement that some people use along with resistance exercise to help boost muscle protein synthesis and the growth of lean muscle mass. Other possible benefits of whey proteins along with the weight loss is that it lowers the cholesterol level as well. Now, the products which are available in the market, they are categorized as traditional nutraceuticals and non-traditional nutraceuticals. Traditional nutraceuticals are the components which we are already incorporating in our diet. For example, we are eating tomato and it contains mainly lycopene belonging to the carotenoids category, vitamin A and carotene in carrot, omega-3 fatty acids, that is polyunsaturated fatty acids in fish oils. If you just look at the non-traditional nutraceutical products, which are artificial foods prepared with the help of biotechnology, and they are of two types. Fortified means they are designer food with added ingredients to enhance the effectiveness and the nutritional value of the food. For example, orange juice can be fortified with the cereals with added orange juice fortified with calcium, cereals with added vitamins and minerals, milk fortified with cholecalciferol, and flour with added folic acid. There are so many examples also. Recombinant nutraceuticals are formed by enzyme fermentation technology as well as by the engineering technology, for example, gold kiwi fruit and the fermented soya. Nutrients like carbohydrates, proteins, they are basically providing the nutritional value. But the nutraceutical products, apart from the nutrients, contain antioxidants, carotenoids, polyphenols, dietary fibers, polyunsaturated fatty acids, prebiotics, and probiotics. Coming to the antioxidants in our body, oxidation occur in the electron transport chain by which the reactive oxygen species, free radicals, singlet oxygen, hydroxyl radical, superoxide anions are formed. These free radicals are very much reactive. They causes cytotoxicity, lipid peroxidation, and they also lead to damage to the DNA, leading to the cancer, aging, neurodegenerative disorders, and rheumatoid arthritis. In our body, there is a defensive mechanism to fight against the free radicals that we are having glutathione peroxidase, superoxide dismutase, catalase, and other reducing agents like glutathione, ascorbic acid, and iron. But if the formation of free radical in the body is more as compared to the internal fighting mechanism, then it leads to the oxidative stress, leading to the degenerative disorders. So we must consume in our diet natural or antioxidants from the food comprising of polyphenols, carotenoids, vitamins, which providing additional benefit to fight against the oxidative stress existing in our body. They can be, there are various sources of antioxidants. Our berries, blueberries, bilberries, pomegranate, all are full of your antioxidants. Superoxide dismutate, isolated or recombinant. This is widely available in the market as a dietary supplement. Tocopherol, vitamin A, present in corn oil, fish liver oil, ascorbic acid. Lactoferrin is also a reducing agent. Carotenoids, carrot and tomato are also coming under your antioxidant. Next, coming to the prebiotics and probiotics. Probiotics are the living microorganisms which improve the intestinal microbial balance. In our body, the useful bacteria are present which will make the gut healthy by absorbing the harmful free radicals also, and the disease causing microorganisms also. And these are the specific strains of bacteria like Bifidobacterium and Lactobacillus acidophilus. On contrast, prebiotics are the substances which reach to the colon in the intact form without getting depleted, and they selectively promote the growth of these bacteria so that they act as a fertilizer for you. If you just look at this diagram, nuts, apple, banana, they are rich in your prebiotics. But yogurt, pickles, and kaffir, they are rich in your probiotics. In market, supplements such as coming under your symbiotics are available in the market, which are a mixture of both prebiotics and probiotics. Means they contain prebiotics also and probiotics also for the additional benefits. Next, coming to the polyunsaturated fatty acids, which are essential fatty acids because they are not formed in the body and are obtained through the dietary means. They are broadly categorized into two types: omega-3 type polyunsaturated fatty acids like EPA, DHA, decoxahexaenoic acid, which is very much required for the development of brain in infants also, in children also, and that is mainly present in fishes, fish oil, flaxseed, soya, canola, and some nuts. Omega-6 comprise of linoleic acid, arachidonic acid, which is also present in various herbal sources. These polyunsaturated fatty acids suppress T cell activation, inhibit cytokinin production from macrophages. Supplementation with fish oil containing EPA and DHA shows protection against bronchoconstriction in asthma. Omega-3 fatty acids reduces the LDL and VLDL level and reduce the cholesterol formation, deposition, prevent the thromboxane formation, and helpful in the preventive measure for atherosclerosis. These are the health benefits of polyunsaturated fatty acids. Now coming to the next important part of your dietary component, that is dietary fiber or roughage. Dietary fibers are those fibers which, when we intake it, they are not digested by the digestive enzymes. They remain intact, and they are basically of two types: soluble fibers and insoluble fibers. Soluble fibers get dissolved in water, readily fermented in the colon into gases, and it delays the gastric emptying time, result in extended feeling of fullness. The source of soluble fibers are oats, beans, and legumes. And soluble fibers lowers the blood cholesterol and improves the blood sugar level. They are also used in your diet. Insoluble fibers do not dissolve in water when inert to the digestive enzyme and provide the bulking. And they are basically used in constipation like isabgol, and they are good for colon health. Next category is polyphenols. Polyphenols are the phytochemicals which are present in many fruits, which help to prevent the oxidative stress. Polyphenols is a huge class which comprises of phenolic acids, flavonoids, stilbenes, and lignans. Phenolic acids are mainly comprised of 1/3 polyphenolic compounds. Berries, fruit, kiwi, cherry, apple, they contain high amount of your polyphenolic acid. Flavonoid is another class. It is a class which comprises anthocyanins, flavonols, and isoflavones. Anthocyanins are found in berries, like it is also there in red wine, red cabbage, black grape, colored potatoes also. Flavonols have been detected in onion, broccoli, and blueberries. Isoflavones are found in soya beans and soya products, which are having estrogenic activity also. Lignans have been found in high concentration in linseed and other grains. And still beans, the most common example is resveratrol, which is found in grapes, cranberries, blueberries, and red wine. Polyphenols have basically it is occurring as an antioxidant. It reduces the oxidative stress in the body, and it can is used to fight against various cardiac disorders. It enhances the immunity. It is used to fight hypertension and cancer. Next category is your carotenoids. Carotenoids are also called as provitamin A because they, on ingestion, they are converted into two molecules of vitamin A, that is retinol, which exert preventive action against degenerative disorders. Carotenoids are useful, efficacious, and non-toxic food colorant in the form of extract. The most common examples are lycopene present in tomato, carotene, saffron. They are rich in your carotenoids. Carotenoids also provide different benefits, like they are acting as anti-cancer, anti-diabetic, anti-inflammatory, antioxidant, hepatoprotective, osteoprotective, and they are also having pro-vitamin A activity. So indirectly, they are having the double antioxidant action. Now, till now, I have discussed the various components of nutraceuticals. Now, I'll be discussing the common nutraceutical products which we are consuming or using in our daily life. Coming to the tea, we all are consuming tea. Tea leaves are first collected and they are subjected to the different processes. Okay, we are using green tea also, we are using black tea also. Green tea is basically non-fermented. Non-fermented means it contains maximum number of your polyphenols. If you just there is one more tea called as oolong tea, which is semi-fermented. It contains partially oxidized phenolic compounds, and it really contains theaflavins and theavirgin. Whereas black tea is the fully fermented. Fully fermented means the polyphenolic compounds like epigallocatechin, phthalate, they are oxidized into your theaflavins and theavirgin. So tea is one of the most popular and widely consumed beverages worldwide. Tea contains mainly polyphenols, polysaccharides, vitamins, and amino acids. The polyphenols in tea are catechins, and their conjugated products like EGCG, that is epigallocatechin gallate, epigallocatechin, epigallocatechin gallate, and epicatechins. They are present in green tea. But if you just look at oolong tea and black tea, these all conjugated catechins, they are oxidized into the different compounds. The other two classes of polyphenols found in black tea are theaflavins and theavirgins, which are present in significant quantity in black tea and less quantity in oolong tea. The catechin polyphenol in tea are health promising due to their antioxidant property because they are coming under your polyphenol category. Apart from these polyphenols, the tea also contains pigments, carotenoids, chlorophyll, alkaloids, mainly caffeine, which is a CNS stimulant, amino acids, lipid, polysaccharides, vitamins, chlorides, minerals, and trace elements, which also add nutraceutical value of the tea. So these are the main constituents of green tea, and green tea is used to fight against various. It lowers the cholesterol level, it lowers the blood glucose level, it burns the fat. These are the possible benefits of your green tea because of the presence of various phytoconstituents like polyphenols, catechins, and other amino acids. Then is your nutraceutical value of cereals. We all are nowadays using whole wheat like rice, millet, bajra, barley, oat, buckwheat, corn, sorghum, flaxseed, psyllium. These all are coming under your whole wheat cereals. In recent years, cereals and its ingredients are accepted as functional food because of providing dietary fibers, proteins, energy, minerals, vitamins, and antioxidants. The nutrients in the cereals have identified perspective for reducing the risk of coronary heart diseases, diabetes, tumor incidence, cancer risk, blood pressure, reduces the rate of cholesterol, fat absorption, and it also delay the gastric emptying time due to the presence of your soluble and insoluble fat. Coming to the nutraceutical value of wheat bran, and wheat germ oil. The whole wheat and wheat bran are the key sources of antioxidants and dietary fibers. They contain free and esterified phenolic acids, which will enhance the potential of wheat in various disorders. Whole grain are rich source of magnesium that act as a cofactor for various enzymes. Regular consumption of whole wheat also reduce risk of type 2 diabetes because of the presence of fiber. They will enhances the absorption of glucose in the intestine. Wheat bran has attention to accelerate the metabolism of estrogen that is known to promote that is a well-known promoter of breast cancer. Wheat also contains lignans, which is coming under your polyphenols, actively protecting the breast against high circulating level of hormones such as estrogen. And there is a significant inverse between measure of fiber intake and colon cancer risk, but all fibers are not equally involved in the protective action against colon cancer. Only wheat bran has been shown to reduce the concentration of bile acid and bacterial enzymes, and it has a possibility believed to promote the colon cancer. Then nutraceutical value of wheat germ oil, which is oil obtained from the wheat embryo or kernels. That wheat germ oil is rich in octacose, phenol, tocopherol, beta carotene, folate, essential fatty acids, including linoleic acid, linolenic acid, and zinc. These all are your polyunsaturated fatty acids. Wheat germ oil is used for increasing blood flow as well as the beneficial effect for the skin. Wheat germ oil is mainly used in the cosmetic preparations also for the skin care, and also has antioxidant properties, strengthening the immune system and restoring the overall health. Then nutraceutical value of oats. Oats contain well-balanced protein and the soluble fiber called beta-glucan. It is a good source of antioxidant and also contain phytic acid. It is a source of vitamin K and various phenolic compounds. The beta-glucan, the present in oats, has the ability to increase solution viscosity, and it is likely rapid fermentation in the small intestine. Beta-glucan are associated with slow nutrient absorption, and it reduces the blood glucose level. Next, coming to the nutraceutical value of barley. Barley is also a rich source of beta-glucan. Beta-glucan is a soluble fiber. It reduces the blood glucose level, and it also reduces the incidence of chemically induced colon cancer. Then colored potatoes we have seen in the market. These are also coming under your functional foods. That purple potatoes, or you can say colored potatoes, they are rich in polyphenols, antioxidants called anthocyanins. These are the same antioxidant which is found in blueberry and blackberry. A higher anthocyanin intake is linked to several benefits, including healthier cholesterol level, improved vision, high health, and reduce the risk of heart diseases, certain cancers, and diabetes. So eating purple potatoes may promote blood vessels and blood pressure health. This may partially be due to their higher potassium content, as well as they reduces the blood pressure, but their antioxidant content likely play a role also. Now, next is coming to the red wine. White wine, you just look at the comparison of your white wine. White wine and red wine both are made from your grapes, but white wine is made from white grapes, and the skin and the seeds are separated from the juice before the fermentation process. But in red wine, the peel and the seeds, the skin and the seeds of the grapes are incorporated before the fermentation. And the seeds and the skin, they are rich in tocopherol, linoleic acid, resveratrol, procyanidins, quercetin, carotenoids, phytosterols, catechin, epicatechins, and the skin is also contain many nutraceutical components like anthocyanins, stilbenes, ellagic acids. So these beneficial compounds are incorporated in red wine. So red wine contain more beneficial compounds than white wine. So drinking red wine in moderate amount will provide additional benefits like boosting heart, gut and brain health because they contain many compounds belonging to the polyphenols which provide additional antioxidant, anti-inflammatory and lipid improving effect. So nutraceuticals play a positive role by maintaining and modulating immune function. Being natural, they hold a great promise in clinical therapy as they possess no side effects that are usually associated with the chemotherapy and or radiotherapy. They uh, they play a specific pharmacological effect in human health, such as antioxidant, anti-inflammatory, anti-allergic, antispasmodic, anti-cancer, CNS stimulant, analgesic, uh, protection against carcinogenesis, immunomodulator, and calming. Conclusion. In particular, oxidative stress is a common factor in the metabolic disorders, or you can say lifestyle disorders like diabetes, cardiovascular disorders, aging, and it is often exacerbated or enhanced by overeating or by physical inactivity. So, lifestyle interventions, including balanced diet and the regular physical activity, have been shown to significantly reduce the impact of metabolic disorder, addressing both their symptoms and underlying causes. Among these, the various nutraceutical or functional food like plant proteins improve the insulin resistance, reduces the triglyceride secretion, prebiotics, probiotics, they modify the intestinal microbiome, polyphenols, they are reduce the production of your reactive oxygen species, they combat against the oxidative stress existing in our body. Among polyphenol, curcumin has attracted great interest for the nutraceutical purposes. It has wide spectrum of effects like anti-inflammatory, antioxidant, anti anti-diabetic, neuroprotective, and antibacterial. Omega-3 fatty acids also shows substantial efficacy in regulating oxidative stress, inflammation, and insulin. EPA and DHA specific omega-3 fatty acids, which in present in fish oil, shows promising effect in managing and reducing the cardiovascular risk. DASH diet, that is dietary approaches to stop hypertension, is a diet which has surprisingly very promising role in the management of various disorders. It is a diet rich in calcium, emphasizing on consuming vegetables, fruits, and low-fat dairy products, nuts, whole grains, fish, and poultry. This diet plan mainly benefits bones also, since it has low acid load and high potassium and magnesium content. So I conclude at the last that modification in the diet along with exercise and management of these all dissolve. Thank you so much.
Thank you, Professor Reecha. Very nice presentation. I think earlier we were having professional dietitians who were suggesting diet. We may need in future professional persons who can suggest us nutraceuticals, because nowadays what I feel is it is most abused thing to use multivitamin uncontrolled use. So the
Yes,
people
sir.
don't know what to use and how to use and when to use. Even same
Yes.
in the case we have certain dietary supplements which we are using, but we are not aware which to use, when to use. Like for example, you said red wine, it is excellent at a particular dose, but excess may affect our gut microflora. So it
Yes,
was
sir.
an excellent presentation. Thank you very much.
Thank you so much, sir.
Thank you. So our next speaker, I will invite Dr. Suresh. He's our colleague at Punjabi University, Patiala. He's associate professor with, I think, more than 22 years of research experience and teaching experience. He has guided more than 50 postgraduate students and about 8 PhD students. He has published more than 100 publications, which has index of 28. He is recipient of many prestigious awards like Bharat Gaurav Puraskar, Eminent Pharmacognosy Scientist Award, Dr. P.D. Sethi Memorial Annual Award for 2020. This is for his paper on HPTLC. Then he has organized many conferences. He has given many, delivered many talks, invited talks, and more than 100 technical sessions. And he has organized more than 40 conferences. And his main field is of isolation of certain phytoconstituents, standardization of those phytoconstituents. And his work on isolation of pure curcumin has been appreciated well by the SEMI Laboratories, Bangalore. He is editorial board member of many journals, including Frontier in Pharmacology, Frontier in Natural Products, Journal of Pharmaceutical Technology, Research and Management, and Journal of Applied Pharmacognosy and Phytochemistry. So his topic of today's talk will be regulatory perspective of nutraceutical. So we have talked of nutraceuticals, but now we come down to how to regulate that for the society. Over to you, Dr. Suresh. Welcome.
Thank you very much, sir, for very nice introduction of mine. So I think I am audible as well as the slides are visible to all of you.
Yes, sir. These are visible and you are audible.
Thank you. So nice of you. So first of all, I'm very thankful. My gratitude to organizing committee member of APAN58 for inviting me, providing me this opportunity to interact with all of you on regulatory perspectives of nutraceuticals at this platform. So as Dr. Rakesh Chavla is not available today, so I'll be covering a few slides related to case reports and vigilance, nutri-vigilance in my regulatory perspectives only. Thank you very much. So why I have chosen this topic, regulatory perspectives of nutraceuticals? Yes, because of global market of nutraceuticals. Last 2 decades, enormous growth in nutraceuticals have been seen. In 2010, it has a global market of 140.1 billion US dollars with annual growth rate of 5% by 2016. In 2016, it increased to 198.7 billion US dollars and with annual growth rate of 7.5% by 2021. And now, in the recent year, it has been observed that it has a global market of 278 billion US dollars. And now annual growth rate has been considered 6.9% by 2026. And as Professor Nirmal Singh said, it will increase to 950 billion US dollars by 2032. Just see the enormous growth in the global market of nutraceuticals. This enormous growth has not only created pressure on the companies producing nutraceuticals to produce a quality product, but also on regulatory authorities to have quality check on these nutraceuticals, because ultimately nutraceuticals have to be consumed by human being. It has been USA contributing about 36% in this global market, European Union 25%, and India has just 1.5%, but it is increasing with time. So I'll be covering in brief regulatory bodies of different countries. In Japan only, Japan Ministry of Health, Labor and Welfare, as well as Consumer Affairs Agency for supplements. They are the regulatory bodies for food items, dietary supplements, or the nutraceuticals. They have the functions of approving food for specified health uses, also take care of food safety. In USA, Food and Drug Administration and the dietary supplement, they take care of, they give the details on regulations, policies, guidelines dealing with the dietary supplements. And India, Food Safety and Standards Authorities of India, where the government give directions regarding the standards and regulation of health supplements and the nutraceuticals. In Australia, Therapeutic Goods Administration as well as the Food Standards Australia and New Zealand, they give detail of existing complementary medicines regulations, policies, guidelines, details on the food standards, policies, and the guidelines. You can go through the one research article I have given here, given by Dwyer et al. 2018, covered other countries also. If you want to check the regulatory bodies and their functions of different countries, you should follow this research article. Yeah, I'm covering in detail the challenges in regulation of nutraceuticals. We have efficacy concern, safety concerns, because generally it is considered nutraceuticals are safe, because nutraceuticals are nothing. These are the products related to the food. These are nutrients, vitamins. So they are safe, but this is not true. They pose some adverse effects. They have interaction with the drugs, and even sometimes unauthorized pharmaceuticals have been included in nutraceutical products. So these are the concerns we should take care. And definitely, role of federal regulatory authorities. That is very important. Strict regulations we require on nutraceuticals. So one by one, we are taking different challenges. We'll try to find out solutions for these challenges, and also some case reports will cover in vigilance. Yeah, efficacy concern. It is generally a concern whether these nutraceuticals, they have therapeutic efficacy or not. This is a general question mark about the efficacy of nutraceuticals. But we have so many examples where these nutraceuticals, they pose therapeutic efficacy, strong therapeutic efficacy, as the cinnamon supplements, they have potential adjuvant. These are the potential adjuvant while dealing with the oxidative stress and inflammation. Omega-3 fatty acid supplementation, they may reduce coronary events and death due to coronary artery disease. Vitamins and mineral supplementation, these are useful in slowing the progression of AMD. Yeah, probiotics. Short-term use of probiotics in association with antibiotics is safe and effective in preventing CDAD, infectious disease in hospitalized patients. So these are some examples where these food supplements, nutraceuticals, they have shown good therapeutic efficacy. But so many examples are there in the article I have mentioned here, written by Komala et al. Yeah, the main concern is of safety concern of nutraceuticals. It has been seen very home remedies, very commonly used nutraceuticals, herbal products, which are included in nutraceuticals, they have safety issues. In 1994, use of ephedra, which contain ephedrine and an alkaloid, that led to 39 deaths and 695 cases of serious illness, ranging from insomnia, nervousness, arrhythmia to hypertension, heart attack, seizures, and stroke. Licorice, a very common household therapy in India, just that help in soothing the sore throat. That has been reported to cause edema and hypertension if used for a long time, because it contains saponins. They can cause edema and hypertension. Even ginseng, well-known plant drug, which is included in nutraceuticals, that causes hypertension, gynecomastia, and vaginal bleeding. So safety concern is there for the nutraceuticals. We can't say nutraceuticals are safe as such. We have to take care about the safety of nutraceuticals. We have seen other adverse effects in many very commonly used herbal products like green tea that may pose hepatotoxicity. Garlic, if consumed 12 gram daily, can have antiplatelet effect that ultimately lead to abnormal bleeding. Soya milk or formula that can cause increased risk of Kawasaki disease in children. Ephedra or ephedrine, as already explained to you, that can cause arrhythmia, stroke, myocardial infarction, cardiac arrest. It has been seen many deaths, permanent disability, and these reports were submitted to US FDA in 1997, and finally it is banned in 2004 in USA. So many side effects we have seen in nutraceuticals. We can't say nutraceuticals are safe as such. So we have to take care while taking these nutraceuticals. So stringent regulations are required for the use of these nutraceuticals so that excessive use should be avoided. Yeah, food drug interaction, another concern with the nutraceuticals. We have seen food drug interactions with the Sanzonwort, very commonly used antidepressant herb, having a huge market in USA. But if it is given to the patient who is already taking triptans, 5-HT1 receptor agonists like sumatriptan and zolmitriptan, ultimately result into potentiation of serotonin concentration, resulting into serotonin syndrome, which is characterized by confusion, agitation, diaphoresis, shivering, tremors, lack of coordination, coma, and flushing. Ephedra, if taken with the stimulants like epinephrine, that result into increased heart rate and high blood pressure. Interaction has been seen with benzodiazepines and kava. Kava is well-known CNS depressant drug. If it is given with another CNS depressant drug, additive effect will be observed, and finally it will cause hypnosis. Black pepper, it decreases blood sugar level, but when it is given with the anti-diabetic drugs, definitely it will decrease blood sugar level to the normal, and finally causing hypoglycemia. Ginkgo biloba, if given with antidepressants like fluoxetine, sertraline, trazodone, this ginkgo potentiate effect of antidepressant drug and causes serotonin syndrome, again characterized by rigidity, restlessness, tachycardia, hyperthermia. So we have seen that generally a patient who is taking drug, along with the drug, the patient is taking some nutraceutical or some food products. There is an interaction, but the patient will not be aware about this interaction. So that is very important. We should have some clinical pharmacologists who can tell about these interactions. Some unauthorized pharmaceuticals have been included in nutraceuticals. It has been seen. Again, I'm taking example of ephedrine, ephedra. We have Renolex, the trade name of this drug, which is used in asthma therapy. Actually, it is a pharmaceutical, but included in nutraceuticals, that is unauthorized product. Similarly, Wincapan is a drug available in the market, which is nootropic drug. Sildenafil and their analogs, these are included in nutraceuticals, but these are drugs are coming under the name of Viagra, which is used in erectile dysfunction. Betaine is also a drug, but included in nutraceutical. Cysteine is a trademark of the drug, which is used against homocystinuria. Cannabidiol is a recently US FDA approved medicine. Trade name of cannabidiol is Epidiolex, used in severe epilepsy. Phenolphthalein, Agorel is the drug and trade name of the drug, and it is used in constipation. So these are various pharmaceuticals, which are used as drugs, medicines, but included in nutraceuticals, that is not acceptable. And ultimately, that can pose some safety concerns. Yeah. Another is the role of federal regulatory authorities. That is very important. Despite these reports are very old reports, because now the strict regulations are included in various rules, acts in different countries. But still, it has been seen marked variation in strength of marketed herbal formulation. We are not able to produce reproducible nutraceutical products. And ultimately, that lead to safety concern. One report says that 25% of ginseng products on health food store shelves did not contain any of the listed compound. A study commissioned by Los Angeles Times found that 3 of the 10 different national brands of St. John's wort over-the-counter remedies contained less than half the active ingredients, whichever is claimed on the label, and 7 products contain between 75 to 135% of the active ingredients. If this is the case, so how we can have a reproducible therapeutic efficacy of nutraceuticals? So ultimately, it will lead to the safety concern. Yeah, I'm covering some case reports related to these nutraceuticals. One case report published by Kalanji et al. In 2023 by Tongat Ali herb. Tongat Ali, that is Eurycoma longifolia, a southeastern Asian herb that possesses various health benefits, especially enhancing the testosterone level. But when the supplement of Eurycoma longifolia, this plant material, was taken by 47 years old male, ultimately lead to acute liver injury in the patient, in the subject. When the supplementation was taken, it resulted into worsening secular stress, elevated liver enzymes, and jaundice. Ultimately, the old male, 47-year-old male, was hospitalized, and discontinuation of this supplementation resulted into clinical improvement. So that was a case report where this herb, which is frequently used in nutraceuticals to enhance the testosterone level, that can lead to acute liver injury. That is one of the case report we have observed, and it is published by the Cleonji et al. Another case report is of weight loss supplement Oxylite Pro. Oxylite Pro is a one product from USP Lab, nutraceutical product from USP Labs. It is used for weight loss and building muscles. When this product was taken by individuals from Hawaii in 2013, it leads to hepatic liver diseases in individuals. 2 persons required liver transplant, and 1 person died because of acute hepatitis. Over total 36 cases were observed. There was a compound present in that is 1,3-dimethylamylamine in oxylite. Later on, new formula was developed by removing this compound, changing the ingredients in this supplement. So that is another case report observed where a supplementation, a nutraceutical that caused acute hepatitis in individuals. The third case I'm taking from the dietary supplement containing monacolin K. A polytherapy, a dietary supplement that contained monacolin K, when taken with sertraline and the rosuvastatin, that is used for reducing the cholesterol, a 70-year-old woman, when taken this polytherapy with drug as well as one dietary supplement which contained monacolin K, Ultimately, that lead to breakdown of muscle tissues in the patient, that result into release of muscle fiber content in the blood, that is a rhabdomyolysis. When it was discontinued, this supplementation was discontinued, dietary supplement, clinical improvement was observed in the wounding. So again, the same case is there. This dietary supplement, which contain monocolin K, when taken with some other drugs, allopathic drugs, sertraline and the rosuvastatin, that lead to rhabdomyolysis in women. This is another case report observed by using these nutraceuticals. So we'll try to find out some solutions. Yeah, some solutions for these problems, safety concerns. We have nutri-vigilance or the strict regulations. I found these two solutions. If we follow these two solutions, we'll have the nutraceuticals with improved therapeutic efficacy as well as good safety profile. Santini et al. Proposed steps to be considered in developing nutraceuticals. If you go through all these steps are the similar steps we use for development of a drug, a medicine, maybe the herbal medicine or the synthetic medicine. If I'm talking about the herbal medicines, in this also we are covering the in vitro studies, isolation of the compounds or making we can say metabolic profile, chemo profile of the compound. Also going for the animal studies, bioactivity guided fractionation, clinical trials, market availability, and we are covering every step that is included in herbal drug design process. So we should follow for the nutraceuticals also. So this is proposed by Santini et al. And this is very correctly proposed because ultimately nutraceuticals are nothing. These are used for therapeutic benefit as a medicine basically. Despite this is not medicine, this is not claimed to be medicine, but the patients or the persons are taking these nutraceuticals for their therapeutic efficacy. Yeah, nutri-vigilance is very important nowadays because we are considering nutraceuticals, these are over-the-counter products and pose no side effects. These are over-the-counter products. We don't need any prescription to take nutraceuticals. We don't need any prescription from the doctor, and we are considering they pose no side effect. But this is not true. As we have seen, so many adverse effects posed by nutraceuticals. So this is not true. So that's why nutri-vigilance is required. We should have vigilance of use of nutraceuticals. Nutri-vigilance involve detection, assessment, understanding, and prevention of adverse effects that are related to use of a food, medical food, or the dietary supplement. Also monitoring and maintaining database of adverse effects associated with the nutraceuticals and dietary supplements so that in future we can take care of use of nutraceuticals. We should know adverse effects associated with some specific nutraceuticals or the dosage of the nutraceuticals. You will take this much amount of nutraceutical that can pose this side effect. Adverse reaction may be there due to these nutraceuticals. So we need the complete vigilance over nutraceutical use. As we have post-marketing surveillance on pharmaceutical products, on medicines, on drugs, synthetic drugs, allopathic drugs. Similarly, we should have vigilance on nutraceuticals also. So here, clinical pharmacologist has to play a very important role to have a rational use of these nutraceuticals. Guiding the patient regarding food-drug interaction, I already told you that is very important. If some patient is taking drug, along with the drug, if the patient is also taking some food supplements, without knowing that food supplement can interact with the drug and ultimately lead to interaction and that interaction may pose severe adverse reaction to the body. A well-known antibiotic drugs, oral sulfonylurea derivatives. If a diabetic patient is taking gliclazide or the glipizide, along with that, a well-known herbal remedy in India, Karela juice, is given to the patient. A patient is taking along with that. That may lead to hypoglycemia in the patient. So this type of guidance is required to the patient. Yeah, this is another function of a role of clinical pharmacologist, that conceptualization, initiation, and implementation of the post-marketing surveillance. As we have post-marketing surveillance for the pharmaceutical product, we should have for the nutraceuticals also. That is important. We should have accurate evidences on safety of these products, so that we should have future plan of use of nutraceuticals. So Malve and Fernandez, they proposed these roles of clinical pharmacologist. Very well written article by Malve and Fernandez regarding nutri-vigilance and role of clinical pharmacologist. Yes, I'm coming to the last slide. The strict regulations are required. As Santoni et al. Proposed, we should have strict regulations on nutraceuticals. These nutraceuticals are nothing. These are basically the products which have nutrients, vitamins, minerals, and the herbal products. When these are the products which are used for therapeutic efficacy, so we should have same regulation as we follow for the herbal drugs or the medicines. So in India, it has been planned to bring these nutraceutical under drug regulators. But now the pharmaceutical companies, they are opposing this plan, because these are over-the-counter product. No strict regulations are there on this product. But when it comes under drug regulator, definitely strict regulations as follow for the medicine or the herbal drugs, that pharma company has to maintain that regulations. So strict regulation as well as nutri-vigilance, these are two solutions so that we have proper regulations of herbal drugs. So with this, I have covered almost every part of regulatory perspectives of nutraceuticals. Thank you very much, and God bless all of you. Thank you.
Thank you,
Now,
Dr. Suresh. Very nice talk in this regard. Normally, what we expect is authorities only wake up when we get to know something bad has happened. So it took many case studies and reports to ultimately wake up the authorities in this regard, that there is excess misuse of these things. And I think it is, thankfully, we are getting certain regulations for the over-the-counter drugs. Although these are required, nutraceuticals are required, but ultimately some regulation has to be there. So it was a nice, very, very nice presentation. Thank you very much, sir. So
thank you very much. One thing I would like to tell here, ma'am, Dr. Dimple Sethi, we have 15 minutes now in this session. So be brief about your session. Thank
okay.
you.
Yeah. So
I'll stick to the time limit.
okay. So I'll
So
just
nice.
briefly, I'll say, so Dr. Dimple Sethi Chopra is our next speaker. She is Associate Professor in Department of Pharmaceutical Sciences and Drug Research, Punjabi University, Patiala. She has been working on nanoparticles, nano formulations. She has got many patents in that. She is also into the editorial boards of many journals. And she's working on field of cosmetics for last so many years. So I welcome him for her talk on herbal cosmeceuticals.
Am I audible?
Yes, ma'am, you're audible.
Yes, ma'am.
Sir, am I audible?
Yes, ma'am, you are audible. Slide show kar dijiye, ma'am.
Okay.
Please open slideshow. Yes. Now it is visible.
Okay. The topic given to me, very good afternoon to TEMDEC, Kyushu University, the chair of the session, Professor Nirmal Singh, and Professor Moriyama. The topic given to me is herbal cosmeceuticals. And if I talk about cosmetics, we go down to the definition given in Federal Food, Drug and Cosmetic Act. The definition of cosmetic is an article which is to be rubbed, poured, sprinkled, sprayed onto the human body. And the purpose is you want to beautify it, you want to clean it, you want to make it good looking, and you are altering the appearance of cosmetics. And these days, everybody is very conscious about their looks. And the products which are included are skin moisturizers, perfumes. We can just think of products according to this definition. And if we check the European directives or the Indian directives, the definition is similar to this. So, this is how we define cosmetics. The word cosmetics is very popular with the regulatory agency. And there is a modernization of Cosmetic Regulation Act of 2022 that amends the Food and Drug Cosmetic Act 1940 to include cosmetic products, which is defined as preparation of cosmetic ingredients with the qualitative and quantitative set composition for use in a finished product. Now, that act, which was Drug and Cosmetic Act, that was way back in 1940. And the modernization has been done in 2022. That is to include the allergen labeling requirements, the product recall, make the regulatory agency more powerful with modernization of Cosmetic Regulation Act, because we have lot of cosmetic product in the market. And saying herbal doesn't mean it's safe. It might be contaminated, it might be allergic to the people. Now, herbal cosmetics. There is a word cosmetics and there is a word cosmeceuticals. What do we mean by cosmeceutical? Cosmeceuticals are just similar to pharmaceuticals because they are having some activity. That is why we call them cosmeceutical. The industrial sector, they use the word cosmeceutical, but but the regulatory agency, they have not used the word cosmeceuticals in their regulatory framework. So the word cosmeceutical is very, very important for the industrial sector. And this is a broader term because there are these cosmeceuticals, they have drug-like property. So they are very popular with the pharmaceutical company. And we have in our BPharm course also, we teach cosmetics, and a part of it is herbal cosmetics. And herbal cosmetic is taught in our university at MPharm level as well. So these herbal cosmetics contain various phytoconstituents like flavonoids, alkaloids, tannins. There are various beauty products in the market, and we have seen that the growth is very, very large. The estimated growth in 2027 would be very, very high. The cosmetic products, if you classify them, the major share is of skincare. Then comes hair care. And then comes the fragrant products and others. So majority is the skincare market. And people these days are talking about anti-aging products. So anti-aging product means skin is involved. And these are the various routes through which the cosmetic product can permeate the skin. Usually it is applied topically, but you can have some adverse effects because of the permeation. The skin aging, which we usually have these days, everybody has dark circles sitting on the mobile or on the using the laptop, and a lot of stress is also there that leads to fine lines and dark spots. But if we are going for a conference or a meeting, we would like to look good. So we need some instant relief. We need a gel type formula which, when applied to the skin, nourishes the skin instantly. We are very short of time these days, and skin aging is a problem. Premature aging is a problem these days. So the effect of UV radiation on the skin, like it depends on your job profile. Some people are exposed to UV radiation to a large extent, and it is the reactive oxygen species which is the main culprit, which is causing premature aging in the human population, which we call it photoaging. The photo aging, like they say, the blue light from the laptop is responsible for aging. So the mechanism is almost same to the UV radiation. There are certain antioxidants which have been extracted from the plant extract, like your oranges. They contain rutin, hesperidin, and these antioxidants, which are phenolic, if you check the chemistry, they are flavonoids, and they are very useful for treating fine lines, hyperpigmentation, dark circles, or wrinkles. There is a product by Derma Company where they use the coffee caffeine and they use the green tea extract, and that is sold for around $50. Then another plant is licorice that also shows very powerful antioxidant activity. In this session, I think this plant is mentioned many times. These are various antioxidants like oregano on the pizza toppings. The oregano is also rich in antioxidant. The Ocimum sanctum or Ocimum basilicum, that is rich. Even the thyme is rich in antioxidant activity. And this antioxidant activity act as a free radical scavengers. It controls the reactive oxygen species. Now, recently, there has been an interest in algae. Algae has been used in cosmetic industry to large extent. Microalgae is also there and macroalgae. We usually see the green algae growing during the rainy season. There is, of course, a red one and a brown. That has been used in cosmetics. And the sustainability of the cosmetic product, as Dr. Suresh said, the ingredients of the cosmetic product should be reproducible. Today, I am selling a product which is giving me good result. But after a few months, that product does not contain the ingredients mentioned on the label because the ingredients are shortage in the market and they are from a natural source. You might not have the same quality. So sustainability and reproducibility is of prime importance. So if you can have such a source which is easily available, the cosmetic industry would sustain onto it. So this is the distribution. The brown algae is having a number of product, and then red algae and green algae, and then comes the micro algae. These algae have got large antioxidant activity, very less anti-aging activity, and anti-melanogenic activity. This is the distribution. Antioxidant, then antimicrobial, anti-aging, and anti-inflammatory. So all these property coupled together, that gives you a very good cosmeceutical product. You need not add lot of ingredient into it. because multi-ingredient standardization and quality control is a major issue for the industrial sector. There are certain seaweeds like Fucus laminaria, and they are being used in cosmeceuticals these days. Now, regulatory control. European Union has banned around 300 chemicals to be used in cosmetics. Like if I have prepared a cosmetic product in India and I want to market in European country or in USA, I have to follow their guidelines. Similarly, every country has its own guidelines, and now people are becoming more and more conscious. So you should have a zero waste policy. These days, it's a go green. So even during the manufacturing of the cosmetic product extraction, you should have minimum pollution and you should have green synthesis approach. Now, we are talking of personalized treatment these days and 3D printed skin. That was the first product in the market as far as living organ is concerned. And skin with the all the three layers, epidermis, hypodermis, and the subcutaneous layer. All the three were bioprinted, and that gives a personalized treatment in case of wound injury or in case of burns. And this has totally changed the scenario. And now we are having artificial intelligence with the facial recognition. They have prepared 3D mask, face mask. They will be similar to the face serum that is applied these days. So this is the technology about the cosmetic product, and these are the various marketed product. You will see green tea that has been put into various nano formulations, let it be nanoparticles or liposomes. And these are few marketed algal based products. So the take home message is the regulatory aspect of cosmetics is very, very important. And you should bear the regulatory aspect in mind while preparing the cosmetics. Thank you so much.
Thank you, ma'am. Thank you for a wonderful session and very brief session as requested to you. Thank you very much. Ma'am, you have in a very simplified manner defined the terms cosmeceuticals. You have covered various cosmeceutical products along with their regulatory aspects, personalized treatment, and marketing products and cosmetics. So thank you very much for very elaborated and brief introduction about cosmeceuticals, herbal cosmeceuticals. Thank you. Thank you. So as 3 minutes are left, we have completed all the sessions today, and I offer thank you for giving me this opportunity to offer vote of thanks for our APAN organizing team, Dr. Yukiko, Dr. Fumiko, and all organizing committee members and the participants from different countries for joining to this online session. Thank you very much to all of you. Thank you very much. Now I request Dr. Yukiko to have some words on this session.
Yes.
Over to you, Madam Yukiko.
Thank you for participating in this APAN session, and I hope to see you in next APAN59 too. Yeah, thank you.
Thank you, ma'am. what I feel about this session. This is very important topic, nutraceuticals nowadays, because of its global market. So definitely we'll take another an eye-opening session in natural products in APAN59. Uh, I think it is in Japan only. Yes. And we'll love uh, to join that session offline if you permit. Physically, we would like to join that APAN59. So still we have 1 minute. So we can request Dr. Fumiko to have some their views about this session.
Hello.
Hello. Hello.
Hello,
You're
Dr.
not
Fumiko.
you're not audible, Dr. Fumiko. Sorry, you're not audible. Dr. Fumiko, we
Not
want.
yet. Okay, I will give her my audio set.
Okay, okay. We want concluding remarks from your side, ma'am.
ドクターふみことずっと違いますけど。I have changed my handset. Can you hear me now?
Yeah, now we
Yes,
can
yes.
hear you.
Okay. I am not a doctor. I'm a coordinator. I was organizing the
Okay.
whole session. So thank you very much for your cooperation. I appreciate that. And as always, I'm looking forward to your presentations because I'm not a doctor, so I don't understand the medical issues, but the natural products is one of my favorites. All the slides are so nice, so I love it. Thank you very much. That's all from me. Thank you very
Thank you.
much.
Thank you. Thank you, all the participants, all the speakers, chairperson of the session, chief engineer, Dr. Dandeep Singh. Thank you, all of you. Thank you very
Thank you.
much. Thank you.
Thank you.
Thank you very much.
佐田さん、ありがとうございます。はい、大丈夫。
So, can we have one photograph? Just the print screen.
How about Dr. Dandeep?
I think he has lost connection. Dr. Dandeep has lost his connection.
Yeah, I don't see his name. Okay. So, yeah. Should I take picture? Photo? Yes. Okay. Okay. I'll count 3. Okay. 3, 2, 1. Once more. 3, 2, 1. Smile, smile. Just a moment. Okay. 3, 2, 1. Yes.
Thank you.
Mm-hmm.
Thank you, ma'am.
Okay, I will send this photo by email.
Okay. Okay, ma'am. Okay.
Mm-hmm.
So now can we leave? No?
Yes. Yeah.
Okay. Right. Thank you. Thank you, all of you. Thank you.
Thank you so much.
Thank you. Bye.
Bye.
See you.